Hi, welcome to Unscrubbed. I'm Dr. Abhishek Mangeshika. I'm a gynecologist and an endometriosis surgeon. I lead a multidisciplinary team, which is a tertiary referral center for India, Asia, and the Middle East, specifically for endometriosis care. This podcast is going to go through a series of episodes where we're going to focus on endometriosis, deal with different patient experiences, so they can relay their stories of struggle. So hopefully the patients who are coming after them do not go through the same struggle on their journeys, and also to create more awareness about the disease. On today's episode, we're going to focus on nutrition and nutrition related to endometriosis. We have Manisha Mehta, who is a well-known nutritionist, and she is very crucial part of our team dealing with endometriosis and the inflammation that comes about with this disease, and tailoring specific diets for the patients who are going to see her. So welcome, Manisha.
Thank you.
And why don't we start with, you can give us a brief introduction about yourself and how you came to be where you are and what your interests and what shaped you into this position today.
Thank you, Doctor, for having me here. So, as Doctor said, I'm Manisha, and I have been in practice for more than a decade now. And so, my inspiration goes back till when I was in the 8th grade, and that's when I decided that I am going to be a nutritionist, come what may. So, naturally, with that in mind, and then, going through the whole path and studying everything, and finally was working from home, and then said, no, this needs a formal setup. And then, after moving to a clinic, and then I started looking into a lot of obesity patients, a lot of kidney issues, a lot of liver issues, a lot of heart issues, and of course, PCOD and thyroid and all that. And after meeting you, got into the endometriosis scene also. So I have realized that when it comes to food, a lot is to do with the mind also. So that's when I did my master's. I studied my master's in psychotherapy, which kind of like really helps me when I'm dealing with a lot of cases at the moment. Especially with your cases, with a lot of endometriosis cases, we have seen that a lot of mind is also involved with the patient. So yes, when I'm looking into it, go into the case history, understand the person, I hear the person, what they have to say and what they don't say also. And that's when we start our journey with them.
That's I like the approach that it's very
Thank you.
about listening to the patient and not just putting out a blanket algorithm or a formula there.
Thank
Which
you.
is, of course, why the personal touch goes the long way, especially dealing with patients who have a lot of, like you said, anxiety related to their pain. They've been gaslit for many years.
Yes.
So I think that's a very interesting point to put across there.
Thank you.
Why don't you walk us through what a typical intake with an endometriosis patient looks like in your clinic?
Okay. As soon as the patient comes in first is definitely I go through all their reports and then make a complete history. Now, when we talk about the history of the patient, I go back even to the childhood at times, because related issues come up now at this age. Women, what is their age? Where do they stay? What is their food like? What is their diet like? What kind of background they come from? Married, unmarried, children, no children, working, which part of the world or in India they're staying, and the other medical history, like, whether are they dealing with thyroid or PCOD or whatever other issues that are there. Obesity, I would not say as much, but everybody who comes is like, what? I also want to lose weight. And why not? Fair enough. So that's the first step that we would do. Once I gather the entire history, and if you have recommended, okay, this person needs to go off this or needs to eat more of this, then we start planning. Once we start planning, that's when the patient will realize, oh, you know what? If I eat this, I'm getting bloated. If I'm doing this, this is happening to me. Where we look into if they're dealing with any food allergies, because those definitely come up a lot especially with patients who are dealing with endo. You cannot relate that, okay, was the bloating because of the food or is it because of the endometriosis? Once we sit and the patient is sitting with me, it has to be a very informal and a very conversational thing and a very friendly thing. And I truly believe is when I'm dealing with it, I'm dealing with a human being. And it's a patient who's gone through so much pain. And today, if I have to stay and sit there very firm and look like, you know what, I know what I'm doing, no, doesn't work. It has to go down to their level. Whether you are 25 or you're 45, you go down to the level and talk to them. We take their history, then I will sit and understand as to what is their daily routine like. What time do they wake up? What is their line of work? What is the kind of food that is made at home, or are they cooking it themselves, or do they have help? The reason why we do all this is today, if it is a person who's from the north, I cannot give them a diet that's completely of idli sambar and curd rice. And if a person is from south, I cannot say parathas when they're only eating rice. So that is a very important factor. Secondly, is it a working woman? If she's a working woman, I cannot expect her to get up at 5 in the morning, make dabbas for everybody and for herself, and then leave. Or if she's in a joint family and, mother-in-law says, I can't make something separate. Okay, so if you can't make something separate, give her something that the entire family can eat. Stress, I have to reduce stress for her, at least on this front. The minute that stress starts coming down, we have seen that she starts feeling better. It may not be physically, but mentally she knows, okay, there's somebody I can talk to, somebody I can call up, or somebody I can message and who's going to reply back. Starts there. We get the entire history and then we have written down, and then I will start. Okay, so when we start in the morning, they say, we get up and this is what we eat, and this is the afternoon meal, and this is the dinner meal. And that's the entire story with most of them, 3 meals. That's when I would jump in and say, you know what? Since we're dealing with a lot of bloating, we cannot go so hungry. So those intermittent foods that are giving in between. Once we do this, they realize that, I'm eating so much. Will I put on weight? Because that is the main thing. A woman's weight is the biggest issue for her. You can be as thin and yet have that body shame in you. So once we do that, and then, they start eating periodically, but what they eat periodically is where we look into. There are certain foods that we have to or we eliminate, especially if you're dealing with this endometriosis, because we don't want their hormones going imbalanced, because anyway they have an issue because of that. And there are certain foods that really help them.
That's very interesting. Thank you for that walkthrough of what a day in your life looks like with an intake with a patient.
Thank you.
So coming back to what your patients were and what you've seen with endometriosis patients, is there anything that quickly jumps to your mind, a very interesting or a very difficult case that you had to tackle with or deal with that, is setting the bar for you and you found very difficult to achieve or to get them to kind of follow your plan?
So yeah, a lot of interesting cases, and of course we don't reveal names, but we can talk about the case. So there have been a lot of cases, and somewhere I've seen the more complex it is, the more complicated it is really interesting. So there was this one case that I was dealing with, and very normal, and we started everything and we started doing all the history and all that, and suddenly we realized that she has this thing where a plate cannot have all the colors. All right, it has to be a single colored plate. When we're talking about a single colored plate and you want to give her foods that are multicolored, because that's what you kind of have to have, was a little difficult. So that was a very interesting case. And another case is where we were dealing with a lot of mental issues, a lot of suicidal issues. So to understand her, first was talking to her, first was getting to understand her, talking to her brain, talking to her mind, and then dealing with the food. So that was one of the tough cases because we were dealing with that. Another case was with an eating disorder, which was not helping because, anyway, if you tell, even if you give her like a gram more, she would go and throw it up. And anyway, we were dealing with this case. So, that was one of the complex case that was there. So these are different kinds of cases that we're dealing with.
Yeah, I see. You have to wear many hats in your practice,
Thank
not
you.
just nutrition. You have to be there to look after mental health and understand the root of the problem to correct the nutritional part of it as well. So, I mean, I really wanted to stress upon the need for a personalized approach in this. And you see a lot of especially in today's Instagram world, where there are self-proclaimed gurus on the internet, which are giving particular specific diets for endometriosis, which I personally think are very harmful, because
Right.
you're completely eliminating food groups and putting them into a caloric deficit, but they're also leading to a lot of nutritional deficiencies. So is that something I think you would like to talk about and
Yes.
address this?
So I will say, like, I'm not going to disregard anybody. Everybody knows their work and everybody is doing it for a particular reason. What is very important, and I think I really stress on this, is you have to look at each case as an individual. Today, each person, each individual have different needs, different, as I explained earlier, where they come from and all that. More so, what kind of a diet will suit you may not suit the other one. So it's nothing like a family diet. You give one person and the entire family can follow, which is what is happening. All right, for a woman, maybe a little easy because she can make the entire thing for the family. So yes, when we are dealing with individual cases, what also comes here is she dealing with any kind of diabetes or hypertension or a heart disease or thyroid or PCOD? So then you have to deal with that issue as well, not just the endo. You cannot do 1 week of endo diet, 1 week of thyroid diet, 1 week of cardiac diet or something like that. The diet should be such that it is looked as whole and given as a complete package, that this is what we're going to do and these are all the things that we're going to look in, because each problem has different eliminations and introductions. But now the trick here is to balance it with all the issues together. So that is very important, which is why personalized diets really help in this, more than following the foods. And going calorie deficit does not work. It does work, but to some extent, I feel that when you go calorie deficit, you're losing out on your energies. Who said carbohydrates are not good? How are you going to get the energy to get up next morning and make your food? You need that little carb. What carb you eat is where we come in. How you manage your protein is where we come in. So, yeah, calorie deficit is good, but likewise, also managing the foods, the items, or whatever. Some people prefer giving, oh, you just tell me fish and I know what I'll make. Okay, we can do that, but at the same time, like if I'm giving you a fried fish, where are my trans fats are going in, my fats are going in. So we look into, okay, this is the product that you're going to make, and what you're going to make is where we run through. That's how we'll go about it.
That's very interesting.
Thank you.
So I deal with a lot of bowel endometriosis cases. I have a lot I do. I think my largest volume of my practice is bowel endometriosis. And of course, with these patients, one is it's taken them years and probably close to a decade sometimes to get to a diagnosis. They've had multiple surgeries before and the diagnosis was not made correctly. So when it comes to bowel endometriosis, you always see a lot of bloating, a lot of digestive issues.
Yes.
Surgically, yes, you can remove the disease, but this patient has been suffering the nerve hyperstimulation because of the inflammation within the body for years and years. And of course, that takes time even after removal of the surgical disease, or rather the surgical pathology, to correct itself. So how do you recommend dealing with, bloating and inflammation? And so a lot of stuff has been spoken about anti-inflammatory diets. So what is an anti-inflammatory diet?
Okay. So first and foremost, I have to mention this, most of the women who I've dealt with have gone world around looking at every doctor and finally they're swearing by Dr. Abhishek. And absolutely, the way you have diagnosed some people, and some people have when they start talking to you, they tell you, I went to 10 doctors and finally I've got my answer. And I'm like, thank you, God, there's somebody who's there who's really identified an issue with this whole gamut that is there and actually looking into this. Saying that, yes, when you deal with a lot of these bowel issues that are there, so bloating is one of the big things, is what we have seen. Likewise, it's not just the bloating, but we also deal with a lot of constipation issues or loose motion issues. Both ways, we go that way. So coming to this anti-inflammatory diets, or let me put it like a diet, let's not give it an anti-inflammatory name, something where I'm not going to be gassy, where I'm not going to feel bloated. I think let's put it in a very layman person, kind of a way. So when we say something like that, what does that mean? It's mean yes, we want to if you're dealing with constipation, you should get good fiber, not overdo the fiber, because when you're overdoing the fiber, that's going to mean they're going to be using the bathroom more, which means then again the pain is going to be there. There are a lot of patients for your patients, which I've seen, have difficulty even in passing urine as well as stools. So now when this comes in, I have to make sure that they're not running to the bathroom every now and then. When we are looking into these cases, what we see is the kind of food that they are eating. All right. How much water are they drinking? Typically, when you've asked somebody how much water you have had, maybe 2 glasses, 3 glasses, well, that does not help. So water is very important in these cases. Also, I know going to the bathroom is an issue, but water is very relevant, especially when the bloating comes in. Talking about these anti-inflammatory diets, what are anti-inflammatory diets? Diets, food items that do not make you gassy or do not, you're not bloated because of eating that. So that's the main thing that we are looking into when we are dealing with such cases.
Yeah, that was very comprehensive. So I was going to ask you, but you already answered it, about water intake and why it's so important. Because one is it helps the absorption of the fiber, which they're going to increase fiber anyway, and also to process proteins. So your kidneys are not overloaded because of that.
I'm sorry, I'll just come in again. Fiber up to a limit, which is monitored. Otherwise, then that can also become an issue. Likewise, protein also very, very individual to the person. You cannot overload them, as you said, kidney issues. But then there's a case which is anyway dealing with a kidney issue. So then the whole trick of treating that patient is completely different there.
Yeah. Do you want to elaborate on that a little more?
So yes, so where they say, water has to be, the doctor has said 1 liter water, 1.5 liter, a gram of salt or 2 grams of salt and stuff like that. And this person is craving for salty food, all right? Because all your life you've eaten, your chevdas and your gatiyas and stuff. And suddenly, you come there and say, don't eat this. So it is a little tough. I think it's more tough mentally than doing it physically. So we start tapering it down. The whole idea is to taper it down. And then once they realize that, okay, even if I've eaten so much, I'm fine, then the whole thing starts working better.
That's a good point about patient compliance. It's
very important.
It's very important to work with them and kind of scale it to
their levels,
to their needs. Something that is sustainable in
Absolutely.
a long term, not as a quick fix.
And sustainable, I would even go a step further and say, like, today you're with Manisha or you're not. Your diet should be something that you can follow all your life. Absolute tweaks in your regular eating. That's it.
So with endometriosis patients, coming back to bowel endo, you see a lot of patients who have tried everything. So they've been given misdiagnosed as IBS. You've been seeing acupuncturists, they've been seeing nutritionists, they've been seeing everybody under the sun. And a lot of them go off everything. So they swear off dairy, they swear off meat, they swear off proteins, they swear off gluten, and eventually end up almost on a raw vegan diet. So do you see a lot of nutritional deficiencies in the endometriosis population in general?
Yes. So let me just go one step further behind and say, yes, there are certain foods that we have to avoid, especially the foods that you've mentioned, especially red meats is something we tell them to avoid initially. And then we go to gluten and then dairy. So when we're looking at dairy also, what we have to understand that, is it the cow's milk that's giving an issue, or is it the buffalo milk or the goat milk, sheep milk? Now, if you talk about people in India, mostly we're doing a buffalo milk or a cow's milk. So then we substitute that, okay, it's okay to have buffalo milk monitored other than a cow's milk. Cow's milk we completely eliminate. So certain food groups are also avoided. That is definitely necessary. So yes, there are deficiency that we see, deficiency, especially I think a B12. Zinc is something that we will also start giving through food and all that. Magnesium, we give through food. B12s. So basic multivites is what they are lacking, because they have anyway stopped everything. And then once they start coming and getting back on track, that's when it all starts coming back into order. But yes, we do see a lot of deficiencies that are there. Not as much, but yes, they are there. So when we talk about an endo diet, all right, what is an endo diet? Okay, so when we talk about, say, you've come to me as a patient, and what is it that I will do with you? All right. So the first thing that we do is an elimination process, where there are certain food groups that we will eliminate and introduce at the same time. All right. Eliminate things like, dairy, as you mentioned, gluten, of course, alcohol, smoking, trans fats, etc. That's what we will stop initially and introduce the omegas. Could be fish, could be flax, could be chia seeds, stuff like that, nuts, seeds, fruits, vegetables, different kinds of fruits, etc., stuff like that. First month will go in the elimination process. The minute I have started eliminating things, within a week or two, we see a difference. Now, what do I mean by the difference? The difference being the bloating has come down. I'm feeling better, I'm sleeping better, my energy levels are better. I think that's a big tick mark. The minute the energy level starts getting better, that's when you know that the progress has started. The second month would be introduction of these items, but you cannot suddenly introduce everything together, because the body is not going to understand that, hey, what just happened? I mean, everything is coming. Slow introduction. When we talk about a month, some people take 15 days to get on track. Some people take 2 or 3 months to even get out of the phase 1. So it's very individual. Once we've done the introduction, we monitor. We monitor to see, are we going back to the same symptoms or are they getting relief? Once they start getting relief, then we start getting back to normal, as in getting back to our normal diet. By normal diet, yes, certain food items for about a few more months is something that we will completely stop. And then slowly, they come back to me and then, okay, now we can introduce. And then that's how the process is actually there. Along with this, so this is something that I really, truly believe in, is I think any disease, whether it is endo or obesity or heart related, kidney related, a lot of mind is involved in this. When we talk about mind, yes, I do believe in yoga, I do believe in meditation, and somewhere, I have experienced that doing a little has also helped. With an endo patient, you cannot expect them to do rigorous exercises and going to the gym and doing pelvic exercises and dumbbells and stuff. But slowly we can start doing that. The best way to do is start with a little yoga, a little stretching, a little here and there, and then we start doing that. Another very easy trick, where we say, please walk for 30 minutes a day. Today, if you have to go for a 30-minute walk, when am I going to get the time? The first question is, I'm working, I don't get the time. All right, it's very simple. Don't climb upstairs, because anyway your hip is not in the right position, and you cannot do so much. You've eaten your lunch, you've eaten your breakfast, you've eaten your dinner. Just 10 minutes after that, walk around your space at your pace and in your home. The minute you do that, at the end of the day, you've done 30 minutes of walk.
So, can you give us a couple of takeaway messages or take home concepts that we should glean from this wonderful conversation we've had today?
Meditation. Coming to meditations and affirmations, very important. Yes, we are not yogis who are going to sit there and, literally get into that meditative state. What is important is calming the mind. When we talk about calming the mind, you can just simply have any music that's playing, or even coloring. Some people find it coloring, some people find meditation in form of coloring or planting or any hobby of yours. But giving yourself that 10 minutes of me time is very crucial. And the best way, what I have always told my people, a cup of chamomile tea at your window, just look out and spend 10 minutes to yourself. Reflect back, journal what you have felt, write down what you feel through the day. And then, literally, when you go back and see 6 months, once you're done and you're feeling better, when you go back and say, my God, how far have I come? This is what I was suffering, and this is how I feel today. The minute you start doing that, the minute you start, telling them to do these things, and they find it doable, because you don't have to go out and spend, you're just on YouTube and you get everything there. and you're gardening in your own house, you're sitting by the window, you're just doing things like that. But that process of giving yourself 10 minutes does wonders by the end of this whole, journey that we spent together. So yes, it's very important spending your me time. And I would also say that to Dr. Abhishek. Do you give yourself those 10 minutes of me time?
No, I was about to say, I said this sounds more advice targeted towards surgeons than for endometriosis patients, but I think everyone can take a page out of that book. And
Yes.
I do see the
Relevance.
sound
Yes.
science behind it as well, that
10 minutes.
you do need that time, because I mean, with our lives, we have literally no time to do anything except we're focused on, or we're thinking about the next case, or we're thinking about what we're doing the next day, or and
So something where it could be just your favorite music, it could be Metallica for all you care, but those 10 minutes of just listening to that, you have a different gush of energy that comes in you.
Yes.
So yes, so I'm glad that I know that from here on you're going to give yourself those 10 minutes.
Yes.
Thank you.
We listen to Metallica in the OR.
Absolutely. Absolutely.
For those of you who've made it so far, thank you for staying in with us. And I personally have learned a lot from Manisha, and I hope you have too. And thank you so much for being here and for doing this.
Pleasure.
And we have all of her socials in the link below. And if you want to follow us on Instagram, LinkedIn, or Facebook, that's also mentioned in the bio. And thank you for tuning in.